All right, Amy here, going to do my case presentation on hemophilia. The patient's a 7-year-old male, Emmett, who was brought to the ER by his parents because of bleeding that wouldn't stop after falling while playing. His symptoms: Emmett's parents say they have noticed that he bruises very easily. He complains of his legs hurting. They also have noticed that he just keeps on bleeding even after just a small cut on his shin or a random nosebleed. His history: Mom reports that her brother, Emmett's uncle, has a bleeding disorder but wasn't sure what the disorder was. Mom notes that Emmett will bruise just from rubbing up against a certain item. Emmett had 2 teeth removed a few months ago, and the dentist said that he had a hard time controlling the bleeding. Upon physical exams, there's scattered bruises on Emmett's legs and arms, as well as some bruising on his trunk. He has edema in his left knee. Otherwise, the exam is unremarkable. So the diagnosis: Emmett's symptoms, history, and exam findings are concerning for hemophilia, which is a genetic bleeding disorder due to a deficiency in clotting factors. Because his mom's brother has a bleeding disorder, and the fact that it's an X-linked inheritance, as well as the easy bruising, painful joints, and bleeding that won't stop, hemophilia is the assumed diagnosis. There are 2 hemophilia categories, A and B. Hemophilia A is because of a deficiency in factor 8, and then hemophilia B is a deficiency in factor 4. Diagnostic tests: his coagulation, his PT was normal, his APTT was prolonged, which is abnormal, and then for factor 8 activity, it was decreased, which confirmed hemophilia A. Factor 4 activity was normal. For hemophilia, a treatment of replacement therapy with plasma-derived factor 8 will help control the bleeding. Emmett may also receive the DDAVP, which is desmopressin, to help decrease bleeding. And that is that case study. Thank you.